So we're going to talk a little bit more about ventilation in this video. This is the second video for chapter 31, the respiratory system. And we're going to talk a little bit more about ventilation, and then we're going to move into disorders of the respiratory system. So a little bit more information. The lungs are in what I've been calling the chest cavity, but what is more properly called the thoracic cavity. And so this is a diagram of the thoracic cavity, sort of on the outside and a cutaway. And so you'll notice that the rib cage does form the top and the sides of the thoracic cavity, and the diaphragm, which is the muscle at the bottom, actually forms the floor of the thoracic cavity. So the lungs are surrounded by a membrane that's called the pleura, and the pleural cavities are actually filled with what's called pleural fluid. So if you look at this diagram, you can see the lungs proper, and you can see the pleura, which are surrounding them, and the pleural fluid that is actually within the pleural cavity. And so the idea here is that this pleural cavity is actually filled with pleural fluid, and it serves as a lubricant, and it keeps the lungs moving smoothly. But the other thing that it does is to keep friction from occurring between lung tissue and other organs that are actually in the thoracic cavity. So the thoracic cavity is jammed pretty tight with a lot of things. There's the heart, there's the lungs, there's the trachea, there's the esophagus, which will swell and contract as food and water move through it. So there's a lot of action going on between the lungs expanding and contracting, and especially the heart beating. And there's a lot of potential for friction to build up between these organs. And the problem with that would be that friction causes inflammation, and inflammation causes tissues to get pretty sticky. And so I don't think that you'd want to have your lungs and your heart sticking together. So that's the reason why the lungs are contained. I'm not contained in, but they're surrounded by this pleural cavity and this pleural fluid. Okay, so nervous system actually plays a role in controlling ventilation. Actually, it's in complete control of ventilation. And ventilation is controlled in the brain by a part of the brain which you've seen before called the medulla oblongata. And so I've got a little bit of an educational video here on the medulla oblongata.
Of an enlarged medulla oblongata. It's the sector of the brain which controls aggressive behavior.
That is correct. The medulla oblongata.
Mama
The
said.
medulla oblongata.
So actually, Colonel Sanders is wrong. The medulla oblongata is not responsible for anger, fear, or as he puts it, anger, fear, jealousy, and aggression. The medulla oblongata is actually responsible for regulating respiration rate and heart rate. And so a little bit later in this scene, of course, he's in the process of saying there's something wrong with his medulla oblongata. And the problem is, if there was something wrong with Bobby Boucher's medulla oblongata, he'd be on the floor dead. So again, not anger, fear, jealousy, and aggression. You can tell I enjoy that too much, but control of respiratory and heart rate. Okay, so if somebody is unable to breathe on their own, if they've got paralyzed rib muscles, or if they've got problems with their diaphragm, or if the lungs fill up with fluid or with scar tissue, and lungs filling with fluid is a particular problem of severe cases of COVID-19, this is when ventilators become necessary. Now, under normal circumstances, you can generate the pressure changes necessary for inhalation by using your diaphragm and your intercostals, and if necessary, some other muscles. But if you can't generate enough force to drop the pressure in your thoracic cavity enough for air to come in that case, you've got to have a ventilator which forces air into your chest, and that's basically their role there. Okay. So our summary of airflow in the human respiratory system, basically you contract the diaphragm and the intercostals. Now, I want to tell you real quick, you don't have to remember this, but the diaphragm is responsible for about 75% of the force necessary to pull air into lungs, and the intercostals, which are muscles that are in between the ribs, the intercostals are responsible for the remaining 25%. So once you drop the pressure in the thoracic cavity and air begins to move in, it goes through this route: nose and mouth, pharynx, larynx, trachea, bronchus, bronchioles, and alveoli. You get gas exchange at the alveoli, When the diaphragm and the intercostals relax, then air is going to reverse and flow back out of the body. So because basically these surfaces have exposure to the outside air, this is a vulnerable spot for us in terms of infections. And so there are things that can affect the respiratory system, infectious agents, pollution, in some individuals, tobacco smoke, and as we'll see, there can also be some genetic disorders that can affect the respiratory system. So let's take a look at disorders of the upper respiratory tract. And so basically the upper respiratory tract is going to be the nasal cavities, the pharynx, and the larynx. So the larynx is sort of your border between upper and lower respiratory tract. Now, because a lot of these structures are involved in filtering the air before it gets down into the trachea and the lungs, it's more susceptible to a variety of bacterial and viral infections. You can also see upper respiratory infections spreading from these areas, from the nasal cavities, the pharynx, and the larynx to the middle ear or to the sinuses, and we'll discuss the mechanics of that in just a minute. So the most common thing is the common cold, and these are caused by relatively mild viruses. Some of them are called rhinoviruses, which I think is pretty funny, but rhino actually means nose. So they're actually named after the fact that they're the most common agents for causing a common cold. But there are coronaviruses that cause mild colds. We're really struggling with COVID-19 right now, and it's because this particular virus, for some reason, is a whole lot more severe than other coronaviruses. So what are your symptoms of the common cold? Sneezing, runny nose, mild fever. This can last for a few days to a week for individuals with a healthy immune system. Now, unfortunately, antibiotics, which work against microorganisms and not viruses, antibiotics are ineffective against viral infections. And so this is the reason why you can't go to the doctor and get a cold cleared up with penicillin. It's because most colds are caused by viruses, and so you usually use medications to treat this symptomatically. In the case of more severe viruses, there are antiviral agents that are becoming more available now. Okay, so we're going to go through these, and I'm going to show you some absolutely delightful pictures. So the first three that we're going to cover are pharyngitis, tonsillitis, and laryngitis. And so pharyngitis is basically an inflammation of the throat that's due to infection. And all that yellow stuff is basically colonies of bacteria. So Streptococcus pyogenes is what causes strep throat. And your symptoms are sore throat, fever, and white patches, these white patches in the throat. Now, this is something, fortunately, that can be treated by antibiotics. And so these symptoms actually do differ somewhat from person to person. There are some people who can have strep throat and run a mild fever and feel okay. There are other people, and I'm one of them, where strep throat will cause a severe fever. I have never run a fever below about 104.5 with strep throat. It's just something that just puts me flat out on my back. Tonsillitis is an inflammation of the tonsils, and so that's the upper picture that's on the right, and those specifically are the tonsils. In this kind of infection, they become inflamed and enlarge, and if you have this a lot as a kid, then you can get a tonsillectomy. And so even though the tonsils have some immune function, if they're constantly getting infected, it's just better to get them out. And this is a surgery that's a whole lot easier on kids than it is adults. From what I understand, an adult tonsillectomy is something that's pretty difficult to go through. At the bottom, we've got laryngitis, which is an inflammation of the larynx. Now, this doesn't necessarily have to be due to an infection. This can be due to, you can have laryngitis from overuse, but basically anytime that you've got laryngitis, you're going to have hoarseness, a hoarse voice, you're going to have difficulty in speaking. Now, every once in a while, if you'll notice what's at the arrows, you can have benign polyps developing on vocal cords, and this is especially individuals that use them excessively, and this can happen with individuals that sort of abuse the vocal cords. This is actually something that I got diagnosed with as a kid. Apparently, when I was a kid, when I got mad, I would just growl. I would really just grind the vocal cords, and so I had this really raspy voice as a kid. And I actually had to go into voice therapy where where I actually had somebody charting how many times I growled and yelled during a week, so that's something that I learned not to do nearly as much. Okay, sinusitis is an inflammation of the cranial sinuses, and so these uh, these are sinuses that drain into the nasal cavities, and so this is basically going to happen when you have nasal congestion blocking sinus openings, and your symptoms are going to be postnasal drip or discharge. You can see that indicated in the picture below, headache and facial pain. Now, up to 10% of upper respiratory infections actually get accompanied by sinusitis. So a lot of the time, it's something that accompanies everything else and makes you just that much more miserable. Okay, this is something that is called otitis media, and it's an inflammation of the middle ear. So media meaning middle, otitis referring to an inflammation of the ear. And so basically nasal infections spread to the ear by way of the eustachian tubes, and that indicates the yellow arrow indicates the eustachian tubes. So you can see there's sort of a connection between the pharynx and the middle ear here, and that's the pathway along which these nasal infections spread. Now, there are a lot of kids who have narrowed eustachian tubes. And when these eustachian tubes get blocked, it makes the middle ear much more prone to infection. And so you can have tubes installed that actually are helpful in kids for this, for chronic otitis media. And if you look at the bottom picture, you'll see that white circle there that's actually a tympanostomy tube. So I'm sure you've heard of kids having had tubes put in their ears, and this is it. It's basically a stent that keeps those eustachian tubes open. Okay, so there are several disorders of the lower respiratory tract. Some of them cause problems by obstructing normal airflow. And so what are the ways that you can obstruct normal airflow in the lower respiratory tract? You can have foreign objects that are lodged in the trachea. This, of course, is going to cause choking. You can have excessive mucus production in the bronchi or bronchioles, and there are a number of things that can cause this. And then there are conditions that can restrict the normal elasticity of the lungs. So lung tissue is normally pretty incredibly elastic. It has a great ability to expand and then return to its original shape. So one of the things that I've done with my AMP2 classes is I have brought in a set of cow lungs and inflated them for them. And it's always a surprise for them to see just how much these lungs can actually expand. So here's the first thing we're going to look at, choking. This is an obstruction of the trachea. And to do this, to address this, you want to use the Heimlich maneuver. So if you look at this little diagram, it says, ask, are you choking? So if they're choking, they may not be able to answer you. You may have to kind of go on your own instincts there. So let's say that the person is awake. What you're going to want to do is make a fist, pull sharply inward and upward, and you're just going to continue just jolting the daylights out of this person until the food pops out. If the person stops responding, then you're going to have to open their mouth, fish around for any food that you can find. If you can't find any, tilt the person's head, pinch their nose, and you may have to try to push air into their airways. Then you're going to want to push hard repeatedly in the chest area for about 20 seconds. So what you're hoping to do is to either dislodge whatever's blocking it or to see if you can force air in around it. Now, if you can't get, if you've got this happening basically in the upper part of the lower respiratory system, you may have to do a tracheotomy, and this is the insertion of a tube into the trachea. Now, the most common place for airway obstruction is actually the larynx, and so you can put a tracheal tube below it. So if somebody's larynx or trachea has been damaged or destroyed, sometimes they'll need a permanent tracheostomy tube. Okay, so now we're going to take a look at some disorders of the trachea and the bronchi, and then after that we'll take a look at disorders of the actual respiratory tissue itself. So this picture on the right shows you acute bronchitis, and if you look at that picture of the bronchus, you'll see that there's mucus lining it, and so This mucus can cause difficulty breathing. So you've got a couple of things happening, and it's inflammation of the primary and of the secondary bronchi. So basically some of the larger tubes of the respiratory system. And the usual pattern of events here is that you get a viral infection that leads to a secondary bacterial infection. And so what's happening now with COVID-19 isn't exactly bronchitis. It's something that's more severe, and we'll talk about that in a little bit. Okay. With chronic bronchitis, the airways are inflamed on a constant basis, filled with mucus on a constant basis. And so if you'll recall the cilia that I talked about before that help sweep particles back up out of the lungs, someone with chronic bronchitis may have a change in those cells that includes the loss of cilia, and that sort of accelerates the damage there because they don't have that mechanism that removes particles from the airways and from respiratory tissue. So smoking is the most common cause of common bronchitis, or exposure to a lot of particulates or pollutants would be another. So bronchitis is a lot more common in a profession like coal mining, and it was became a whole lot more prominent when the Industrial Revolution started up and a lot of more soot started being thrown into the air. Think of like really grimy, sooty London in the era of Charles Dickens, and so that would be a lot of people who would suffer a good deal more from chronic bronchitis. So this is kind of what asthma looks like. This is a disease of the bronchi and bronchioles, and basically somebody has a hard time catching their breath with asthma. Sometimes they'll cough and spit up mucus. But the thing about asthma is that it's triggered by specific irritants. So if you look at the airways below, you can see that a normal airway is pretty open, that the asthmatic airway is actually a little bit more constricted under normal circumstances. So those smooth muscles are relaxed. But when you have an asthma attack, then these smooth muscles will tighten down, and they actually have the potential to squeeze these airways all the way shut, or to squeeze them so far down that somebody can't draw in enough oxygen to survive. So when the smooth muscle in these bronchioles actually spasms, what that does is it really narrows down the air passageways. And here's something that I want you to think about, and is a concept that's called resistance. So resistance is basically the slowing of either liquid or air through a tube when the tube is narrowed. And this is caused by friction against the edges of the tube. And so when air moves through a tube, there's going to be friction generated. And if the tube is narrower, there is a greater amount of the air coming, a greater proportion of the air coming into contact with the walls of the tubes. And this friction makes it harder to move things through the airways. And so I'm going to give you a little analogy. So you may have noticed that if you get a straw in a drink at McDonald's, they've got these nice big fat straws. They're easy to draw liquid up through. But I'm sure that almost every one of you as a kid tried using a coffee stirrer as a straw because it was really tiny and thin. And you may have noticed it's really difficult to draw liquid up through that much narrower tube than it is like the big fat McDonald's straw. And so same thing goes for air. You narrow down air passageways, it's harder to get air through them. So while asthma may not completely block off the airway, it may make it so difficult for air to move through the passages that you have a really hard time breathing. Now, asthma is incurable, but it can be treated with medicines. And so one of the ways that asthma often gets treated is with EpiPens. And so what epinephrine will actually do, it's the same thing as adrenaline. What it'll actually do is, although epinephrine causes some muscle contractions to get stronger, it will actually relax. It'll do the opposite to the smooth muscles in bronchi and bronchioles. And so these air passages will actually open back up. Okay, now pneumonia is an infection in which you see bronchi or alveoli fill with thick fluid. So this is caused by bacteria and viruses and other infectious agents. And what I want you to look at is the alveoli at the top and the bottom. And so the biggest problem with pneumonia isn't necessarily that the alveoli or the bronchi fill all the way up, get completely filled with thick fluid. The problem is that once you have additional fluid resting on those cells in the alveoli, that's almost like adding extra thickness to the membrane through which oxygen has to pass. It makes it a lot more difficult for gas exchange to occur. And so you're going to have a lot of chest pain. You're going to have headache because you're low on oxygen, and you're going to have a high fever because your body's going to want to get rid of whatever agent is doing this. Now, this is the biggest problem that you're seeing with COVID-19, at least in the short term, is pneumonia. And so it causes apparently very severe pneumonia, and people have such trouble breathing that they have to be placed on respirators. Now, when those respirators force air into the lungs, it can force air across the additional fluid that's there. So I'm sorry, I didn't mean to say respirators, I meant ventilators. And so that's the reason why they're actually necessary. Now, pulmonary tuberculosis is caused by a bacterium, specifically Mycobacterium tuberculosis. And as you can see in the diagrams below, lungs will actually build a protective capsule or tubercle around the invading bacteria. That's where the disease actually gets its name. And so you're not getting rid of the infection, you're just walling it up. And that means that at times when your resistance drops, when your immune system drops a little bit, these bacteria have the ability to escape and spread. And so basically the disease will get progressively worse over the years instead of being cured. Now, weirdly enough, even though it's a lung disease, there actually is a skin test that can check for exposure to Mycobacterium tuberculosis. Okay, this is a diagram of emphysema. This is incurable, it's chronic, and basically what's happened here is you've had damage to the walls of the alveoli. So if you look at the normal alveoli on the left and the alveoli on the right, you can tell that there is reduced surface area for gas exchange, and so you're not taking as much oxygen in as you would under normal circumstances. And this is basically emphysema can also be referred to as COPD, or chronic obstructive pulmonary disease, and this can be associated with smoking. Okay, so cystic fibrosis is a recessive genetic condition, and basically this is caused by a defective protein. And what happens in cystic fibrosis, if you take a look at the airways on the left and you take a look at the airways on the right, there are going to be a couple of different things that happen. Okay. First of all, you're going to see a narrowing of the airways, and secondly, you're going to see overproduction of mucus, and third, if that's not bad enough, the mucus is unusually sticky, so it's harder to clear from the lungs. So you have narrowed air passageways, you have increased mucus production. That mucus is thicker and stickier than normal mucus, and what this does is to interfere with breathing. And so it's so hard to clear this mucus from the lungs that you hear about parents with kids with cystic fibrosis who have to basically lay their kids out on a table and strike their back to loosen this stuff up enough to where kids can actually spit out the mucus. Okay, pulmonary fibrosis is when fibrous connective tissue builds up in the lungs, and this connective tissue building up the lungs causes the lungs to be less elastic, and so this says it reduces vital capacity. It can also chop into your tidal volume as well with enough fibrosis happening. So one of the things that's been noticed about COVID-19 is not only does it cause pretty severe pneumonia at its onset, it can also over the long term cause a pretty good degree of pulmonary fibrosis, and so it has the potential to be a disease that can kill you immediately, or it can do a lot of damage long term. So please, by all means, stay indoors. Don't come into contact with other people, and try to wait this thing out as much as you possibly can until somebody comes up with a treatment for it. Okay, Lung cancer is the leading cause of cancer death in both men and women, and 87% of lung cancer cases are associated with cigarette smoking. So it used to be a whole lot more widespread than it is now, but it's still pretty widespread because of this. So there are a series of progressive steps that happen with lung cancer. Um, Very early on, you'll see the cells that line the bronchi thicken up. They'll lose their cilia. So this is something that we referred to earlier. But then the next thing that happens is that you'll see appearances of cells with atypical nuclei. So the nuclei don't look normal. And unfortunately, that's a little bit of a sign that those cells are prone to start dividing faster than normal. And so at this point, when those cells with the atypical nuclei start to divide, they'll lose some of the properties that actually make them lung cells. And so they'll divide very fast. There won't be any order to them. They'll disrupt and push surrounding tissue out of the way. And then, unfortunately, you'll also see metastasis, which is when those cells spread, usually through the lymphatic system and often through the circulatory system to other parts of the body. So the picture that you're looking at on the right is actually a normal lung. This is a picture of a lung for someone with lung cancer. So the last thing that we're going to do is take a look at our typical investigating life thing and ask the question, why do bugs hold their breath? So there are actually researchers that have found that insects will close their spiracles, their breathing tubes, off for extended periods of time, and this stops gas exchange. So the hypothesis that scientists came up with is that bugs hold their breath to prevent oxygen from building up to toxic levels in their systems. So although oxygen is definitely something that we need um, to survive, this is yet another instance of too much of a good thing being a bad thing. So oxygen can be a pretty damaging chemical because of its reactivity if you breathe it in higher concentrations. And so the idea here is that maybe bugs prevent oxygen from building up to these toxic levels. And so basically what scientists did was to put oxygen sensors into moth pupae, and this measures gas exchange over time. And so what the scientists did was to put the these pupae into low oxygen environments and normal oxygen environments and high oxygen environments. And so um, basically what happened was um, if you look at if you looked at the pupae, then insects that were at the highest oxygen concentration, they kept their spiracles open for the shortest amount of time. And so basically, if you'll look at the diagram that's on the right, you'll see that there's some ups and downs to the oxygen concentration in the cells, and the pattern of the oxygen moving up and down, and the pattern especially of CO2 release indicates that those spiracles stay closed. Now, if you take a look at the diagram on the left, you'll see that there's a low O2 concentration. And I really think here that the key here is to look at CO2 release, because that definitely indicates that those spiracles are open. And so at a low oxygen concentration, you see a lot of CO2 release all the time. And this is an indication that those spiracles are open. When you move to a normal oxygen concentration, you see that there are periods during which CO2 is released. So there are periods during which the spiracles are open. When you go to the high O2 concentration on the right, notice that you've got fewer peaks of that green, fewer peaks of CO2 release than in any other concentration. And that is an indication that the spiracles of the insects are actually staying closed most of the time. Now, in all three of those graphs, if you look at the blue line, the O2 concentration inside the pupa, it's remaining at approximately the same levels. So basically, when there's a low O2 concentration, the pupae, they've got their spiracles open. They're breathing in and out as much as possible to try to get oxygen into them. with the normal and the high O2 concentrations, they're breathing periodically. And with that high O2 concentration, even though the spiracles aren't open for that long, they're still getting enough oxygen to keep their internal oxygen levels fairly steady. So as oxygen levels increase, bug respiration decreased. And what's the big take-home message here? The big take-home message, I think, here is that too much of a good thing is a bad thing. So if you are in a really high O2 concentration for a long time, it is something that could actually damage you.